Today we're here to talk about survivor's guilt. Now, COVID-19 is something that is causing, we're all experiencing collective trauma. So what does collective trauma mean? It's something that we're experiencing as a nation. In fact, the whole world is experiencing it. The second wave in India currently is more traumatic than the first for most people. So survivor's guilt is something that we experience when we've gone through a traumatic event or experience, and we somehow deem that we were not worthy of surviving, or that somebody else was more worthy of being saved. So you might have questions like, why did I survive and X person didn't? Or what could I have done more to save somebody else? You can also have questions like, I should have done more for somebody else. So all of this can lead to a lot of guilt feelings, and it's usually found more among those, for example, healthcare workers, where they're not able to save everybody. So there's a constant question of what more could I have done to save the other person. Maybe if I hadn't slept, maybe if I hadn't taken that 5-minute break, maybe I could have worked with one more patient. So one of the biggest risk factors for everybody is that you just need to know someone who has passed away with COVID-19. With the second wave, this is almost every single person in our country. And another one is knowing someone who's had more long-term or severe consequences of COVID. It could also just be believing that you've put yourself in a risky situation and therefore contracted COVID and given it to your family members. Sometimes it could be a pre-existing mental health condition that makes you, that affects your ability to cope with the situation or with the grief that you're experiencing. Sometimes it can also just be that while you're recovering from COVID, maybe I shouldn't have used up these resources. Maybe someone else needed these resources. So a lot of patients may not ask for help as often as they require it, only because maybe I don't need it as much as the next person. So I should maybe be more careful about how much I'm asking for. Survivor's guilt is something which is difficult to differentiate sometimes from normal grief, because we don't always identify or work through or process our emotions as well. So now the first step is identifying it. So what are the signs and symptoms of survivor's guilt? One would be changes in your sleep. So either difficulty falling asleep, difficulties maintaining sleep, waking up early, just having a lot of thoughts before you sleep, changes in appetite, a lot of recurrent obsessive thoughts in a way about maybe someone who's ill, the cause of illness, the cause of recovery, the inability of someone to get better. There could be a lot of irritability, anger, feelings of helplessness, which is again something that most people have experienced during COVID-19. A feeling of grief, sadness, decreased motivation, and as I said earlier, there's isolation. So with the isolation, survivor's guilt, you just don't want to meet other people. However, it is important to do so, but it does cause social withdrawal in certain situations. You could be experiencing a need to overcompensate for the situation, so that you could be doing just way too much more and not looking after yourself. So now how do you deal with this? The first part of it is to allow yourself to feel those emotions and express them. But you know what? It's your grief, it's your trauma. You're allowed to feel it, you're allowed to express it, you're allowed to just be with it if required. So don't allow anyone to tell you what you can and can't feel. Next, remind yourself that not everything is in your control. Especially when it comes to COVID, do what you can, of course. You have to take your precautions. But beyond that, the recovery process, the severity of the illness, none of this is in your control. So you have to remind yourself of that when it comes to feeling this guilt. Prioritize self-care. This is again something when you have survivor's guilt, so like I said, overcompensation, but some part of it is also, I need to be doing more for my loved ones. I need to be awake. I need to not sleep. I need to be there 24/7. So sometimes this can also lead to a lack of self-care, and that is something you need to be very, very careful of, because you cannot pour from an empty cup. So make sure you're getting enough rest. You're taking breaks as and when required. Don't say, I need to do this one more thing for somebody else, so I cannot rest, because you'll see that one person, but you're likely to not do as well a job for the next 10 because you're exhausted. So make sure you're taking your breaks. Sleep well, eat well, make sure that you're being kind to yourself. So this is something we tend to miss out on. So when I say be kind to yourself, the simple one that I go by is, if you would not say this to your friend, don't say it to yourself. You also need to take some form of exercise, ideally 30 minutes a day. Do some mindfulness exercises, do some deep breathing. You can look up the 4-7-8 method. So try all these things to relax. And if you've done all of this, but you still find that you're still having difficulty dealing with your emotions, please reach out to a mental health practitioner. We're all here for you. So all the best. Stay safe.